So if you are tuning into this, this is our BUYOUT debriefing. Our BUYOUT program happens once a month here at Horse Plus Humane Society, and we divert horses that are bound for slaughter to our facility here in Tennessee. So if you haven't watched these before, they're tough times to talk through because we get a lot of horses in pretty abysmal shape. So today we have therapy kittens with us. We got these kitties in today and they're so cute. So they're gonna help us talk about hard things. Nicole and I are just gonna kind of go back and forth. We only ended up getting 13 horses. And if you contributed to saving more horses than that, we had someone commit to bringing some donkeys and mules to us, and then he kind of ghosted us. So hopefully we will get in touch with him. But that's why we have fewer animals. I got abandoned by my kitten.
I will take them.
Okay. If we do not state that pain medications were given, we always give pain medications to anything that is uncomfortable in any capacity. We also know that numbers are very impersonal. Every single one of these horses gets a name. Our supporters name them. So they vote on names and they don't always get named right away. And I like to do these BUYOUT debriefing videos as soon as I can because some of the details leave my brain. So we're basing these on our medical records. And we're gonna try to be as thorough as we can, but not keep you here all day. So our first number is B25-172. Let me also just start by saying there are 13 horses and we still have 5 left. So we had a really tough day. We had to make some hard calls. So B25-172 was a 30-year-old standardbred. He looked black to us, but he had a brand and we were able to identify him based on his brand, and his brand called him brown. So sometimes horses change color a little bit as they age. His registered name was Tsunami, and he was a very well-behaved stallion. He had heart and lungs sounded pretty normal, but his teeth in pretty much all of the arcades except his lower incisors were worn basically to the gums. His capillary refill time was 3.5. So normal for a horse is about 2.5 seconds. That indicator, it's when you push your finger on the gums and you wait for the color to return. That's one of our indicators of hydration. So that indicated that he was dehydrated. He also had a prolonged jugular refill time. So that's another way that we can easily check and see how well hydrated they are when you hold the jugular vein off and if it fills quickly versus fills slowly. He was blind in his left eye, and he had conjunctivitis and a cataract in the other eye. And the eye that he was blind in had a pretty sizable ulcer on the cornea. And I wrote that he was over at the knees, which is not a medically correct term, but his forelimbs at the knee were kind of bent abnormally. And then he was kind of hunched over his pelvic limb. So he just kind of stood with some degree of discomfort. His left hind leg, he had a little bit of a toe drag. And when he walked, his left hind crossed over the right hind. So that's not normal. He also was dribbling urine, like just from the time that he got off through the whole time that we looked at him, he was just kind of dripping urine. So we sedated him just a little bit. He was a little excited that there were mares present, and he became profoundly sedated for a really prolonged time. So when that happens, I always worry that something is abnormal with metabolism. We took radiographs of him and found he also had really bad ear warts. If you've watched Horse Plus for a long time and looked at episodes of Glimmer with Dr. Nancy, he had the same condition that Glimmer had in his ears. So his radiographs, and shout out to Dr. Marina, our incredible colleague who is a boarded radiologist. She sat down with Nicole and I and went over these radiographs with us. So she is helping teach us to be more accurate in our radiographic interpretation. So his right front fetlock, he had, I'm just going to read this real quick and then I'll tell you what it means. Soft tissue mineralization of the collateral ligaments and tendons, lateral sclerosis of the proximal P1, and proliferative degenerative joint disease. So he had really horrible arthritis. In this case, sometimes with horses, I pick what I guess, what looks like the most severely affected joint or one of the affected joints. And I use that to stage arthritis. So I only took views of this one leg arbitrarily. And I assume that because he's 30 years old, he has similar arthritis elsewhere. But we also took radiographs of his teeth. And per Dr. Marina, he had severe attrition, which is kind of atrophy of the structures that are holding the teeth in place. He had multiple furcations, which means a tooth with multiple tooth roots was loose to the extent that you could kind of see the U underneath, which you're not supposed to. He had diastemata, which are abnormal spacing, and then he had hooks and points, and just kind of generally very poor teeth. When I did a urinalysis on him, his protein, he had protein in his urine, his pH was 9, and his urine specific gravity, which is a measurement of how concentrated your urine is, was very dilute. And I actually had to look this up on a paper. So USG less than 1.02 in a dehydrated horse indicates that the kidney function is not normal. So his kidneys were not functioning normal. His USG was 1.005. So pretty solidly below that point that we would consider normal. We also discussed as a team the likelihood of us asking a 30-year-old stallion to undergo castration, even if he didn't have some of these other comorbidities present. Did not feel fair, and he was given the last act of kindness.
So next we have B25 173. She's a 19-year-old thoroughbred bay. She was very sweet. She did get pain meds, and she was a little bit tachycardic, so she had an elevated heart rate. She did have some mild nasal discharge and then scars over her right front. She had severe pain when we palpated her back, and 5 out of 6 lameness in her left front. It was suspected that she probably had a fracture in that fetlock on that left front. So we did do radiographs of both her back and that leg. And based on those findings, which Dr. Lydia will go over since she has the notes from today, we did provide her with the last act of kindness.
In summary, per Dr. Marina, she had crippling arthritis. In her spine, she had evidence of infection in her thoracic spine. She had eroded, lytic, irregular osteophytes and bony proliferation, and just basically all of the indicators of advanced degenerative joint disease, possibly secondary to trauma, but affecting both bones and soft tissues in the leg. And if you watch the footage of this mare, she could no longer extend her leg or really bear weight on it. The kittens are so wonderful.
They are.
Okay.
You're going to have kittens every time.
Yes. Kittens, prescription kittens. Okay. B25 174. Ugh. The cutest little mini mare. We always get these little miniature horses, and I always just desperately pray that we can save them, and they're always in horrible shape. So this little mare, I aged her at 25 years old. Her body condition score was a 2 out of 9, so she was emaciated. She was very, very sweet. Her heart rate initially was in the 70s. Upper end of normal is in the 30s. And even with intravenous pain medication, her heart rate really only came down to in the 60s. She had a heart murmur with point of maximum intensity on the left side of her chest that sounded like possibly a valvular insufficiency, but we didn't do a cardiac ultrasound on her. She had increased peristalsis in her upper left and right GI quadrant. So that just means the gurgles in her stomach were more frequent than they should have been. She did have some diarrhea staining on her back end and tail, and sometimes when things move through more quickly than they should, that results in chronic diarrhea. I wrote down evidence of quitting. So quitting is Quidding, not quitting. This kitten is really biting me. I kind of like it. It's distracting though. It's something that we see in older horses when they have dental pathology and they kind of pack food in their cheeks and they wad it up in a little ball and they kind of spit it out kind of like an owl pellet. So that was indication that she had some dental disease. She had cataracts in both eyes. Her hair coat was not great. Her hooves were overgrown. She had positive digital pulses on both her feet, and she was standing with that kind of hunched over sawhorse stance that indicates pain in the front feet. I graded her at a 5 out of 6 lame on both left front and right front. And I think it's worth pointing out that lameness grading is very complicated, and it's made even more complicated when you have more than one leg affected. So both her front feet hurt her so badly that she just kind of looked hobbly. So if you weren't paying attention, she looked weird, but she didn't look like she was obviously limping. And that's because both of her feet hurt her badly. So we took foot radiographs, and I want to be so clear here that she had great pain medication. She was standing on a rubber mat. Our team is pretty fast. So it's not like we kept this animal in prolonged agonizing suffering. But sometimes the outside of the feet doesn't tell you about the inside of the feet, and we don't ever want to make a euthanasia decision too early or without enough evidence. So we did take the time to take radiographs of both of her feet. She had severe active chronic laminitis that is described as end stage, where her coffin bone was basically dissolving, severely rotated, sunken. She had a big slipper toe. Dr. Marina thought maybe there was evidence that there had been infection at some point, a possible gas tract, but just heartbreaking. And again, laminitis is usually a very manageable condition. If you catch it early and treat it appropriately and you have a good relationship with your farrier and your veterinarian, this is a condition that many horses live comfortably for many years with. So really heartbreaking that we lost this little girl and that she got to us way too late to do anything to help her, other than give her lots of cookies and a peaceful end.
Next is B25 175, 16-year-old mare. We had her down as a Percheron. She was a chestnut. Her heart rate was elevated. It was in the 60s, and she did have increased lung sounds. A little bit of nasal discharge. But her main issue was that left hind leg was massive. The entire leg, all the way down, was probably, 3 to 4 times the size of her other legs. And she was pretty lame on that leg as well. So she has what is called CPL, chronic progressive lymphedema. And based on what Dr. Lydia felt when palpating that leg, it was definitely something that had been there for a very long time, probably years. At this point was not something we were going to be able to treat. Some of the tissue closer to her hoof was just like hard and crusty, and just she had giant black areas. So you could tell that it had been that way for a very long time. So she was also provided the last act of kindness.
And CPL is chronic, progressive, incurable, but also one of those conditions that if you diagnose it correctly early on and address primary cause, whether it's inflammation or bacterial infection, you can manage those horses for a really long time. A lot of them are rideable because exercise is good for them. So this is just neglect. Nobody looked at that horse. Okay. B25 176. I love this mare so much. Her name is Betty. Keep Betty in your thoughts and prayers. She is not out of the woods yet. Betty's about 22 years old. She's a little sorrel mare, and she is just absolute sweetness in a horse body. Just one of those animals that she has open sores all around her face because somebody just left a halter on her, and she literally will walk right up to you and just rest her face on you. So someone just truly kicked her out and ignored her. She does have a heart murmur, and I actually have more information right now that I had just a little while ago because Dr. Marina came down and did a cardiac ultrasound on her earlier today. Dr. Marina wasn't super confident in the findings, so what I heard, I suspected to be valvular insufficiency, and Dr. Marina concurred with that. What she didn't feel super confident was assigning prognosis or staging. So she's reaching out to a colleague who specializes in equine cardiac stuff, who is also a radiologist. So we're super hopeful that Betty has a good prognosis. She has a little bit of soft stool. She does have some dental disease, primarily in the form of some abnormal spacing, but she does have some teeth. She is blind in her right eye. Why did I second guess myself? Because Dawson was the left. Yeah. Okay. She is blind in her right eye, and the eye, it's called phthisis bulbi. The eye is just basically shrunken down. And so her lids have rolled in, her lashes are rubbing on her cornea and causing some discomfort. And she also has conjunctivitis. So completely blind eye causing discomfort. The indications are that we should take it out surgically. However, we want to make sure that she is healthy and stable enough to undergo a standing sedation procedure and that her heart is also healthy. She has a bunch of little small wounds. It looks like she fell in the trailer. And when we did blood work on her, she has indications of an active infection, some pretty significant anemia. And when she came in, she was very, very dehydrated. We actually rechecked her CBC this morning and her hydration dramatically improved overnight. So she's going on antibiotics. We have some incredible companies that donate products to us. So we're putting her on a supplement to help her immune health, her GI health, help her gain some weight. She has a body condition score of a 2 out of 9. And we are going to turn her out with a blind buddy, another sweet mare that cannot see, and reevaluate her over time. So I'm hopeful that we get a positive report about that cardiac ultrasound and that we can schedule her for an enucleation. And she's just precious.
Very, very sweet.
She's a good girl.
B25-177 is a 6-year-old standardbred gelding. Pretty skinny, 2 out of 9 body condition. He was super respectful, very sweet. Everything looked pretty good with him. He did have an old scar on his left hind leg, and we did do some radiographs.
He has a lot of soft tissue thickening on the lateral aspect of his left hind leg. It's big. Mm-hmm. It's like a lot of the leg, like 6 or 8 inches, with exuberant osseous proliferation, which just means something traumatized that bone. Mm-hmm. It laid down a bunch of new bone. But because of where it is, if it was here or here, then we have the major extensor and flexor tendons. Because it's on the side of the leg, it doesn't seem to bother him at all. I actually saw him trot. He sound at the walk and the trot. And he's a really good boy. He does have some nasal discharge and a crusty nose too.
Yeah. So he is out in pasture hanging out, and we'll just keep an eye on him over the next month, and hopefully he should be good since he's doesn't have any major issues.
Our next number is B2578. He was a 19-year-old standardbred gelding. His brand was 7BD13. He was also very thin. I BCS'd him at a 2 out of 9 body condition score. He was very sweet and easy to catch and halter trained. He was also blind in his left eye. He had a lot of scars and wounds. Ooh, this one. So sometimes we look at horses and from the outside we think, this doesn't look too terrible. This horse did have a very abnormal face. So his left eye socket was sunken. His facial crest on the left was sticking out. But I couldn't really tell from the outside because it looked like it had happened so long ago, whether it was stable and something we could manage. So we took radiographs, and it does look like he had fractured his face. He was missing, I think, 4 teeth. But then because those teeth were missing on the top, the bottom teeth didn't have anything to wear, and they were just incredibly sharp and sticking straight up into the hole. So there's no way this horse could have chewed normally. But in addition, and this is where I'm so thankful for a radiologist, because I looked at his spinal radiograph. So this horse was extremely painful on palpation of his spine. Dr. Marina looked at the radiographs and saw emphysema in the soft tissue. So that's gas present in tissue. That is gas inside the body where it shouldn't be. And she said it was likely due to, quote, a horrible infection. So a deep infection This horse had scars from what appeared to be a harness and big scars over the withers, and this gassy appearance was present over the withers. And then Dr. Marina said it looked like there was chronic osteomyelitis of more than 5 dorsal spinous processes of the spine. So his spine itself had been infected, just absolutely horrific radiographs. And then he also had a really bad kissing spine lesion between his L5 and L6 of his lumbar spine. And he was given the last act of kindness. And of course, I don't know why I forget to say this. Of course, he had pain medication. This horse actually had pain medication before he even got out of the trailer. He wasn't able to comfortably bend or flex his neck enough to get out of the trailer without pain medication.
B25-179, a 23-year-old mare, also a Percheron. She was beautiful. From the outside, she looked fantastic. We were all like, okay, a good one. Unfortunately, she had melanoma. Lots and lots of masses. We did provide her with the last act of kindness, and post-mortem did cytology of one of those masses that was around her rectum. And they were just huge, like bigger than a golf ball, multiple, tons of small ones everywhere. And usually, my experience at least, is you need to look under the microscope to confirm that it's melanoma. This you could just put on the slide and visibly tell that it was going to be melanoma. It was just black. So we were really hopeful for her because she was beautiful. But
and it wasn't just teeny tiny masses.
No,
there was a
huge
one that was compressing her anus that was necrotic. Yeah. Poor lady. B25-180 is a 10-year-old Haflinger mare, and she is gorgeous. She's a little sorrel with a blaze, and she has left hind and right hind socks. She is easy to catch, halter trained, bright, alert, responsive. She was great for pokes. Her heart rate and respiratory rate were normal. Her heart sounds were normal. She did have a little bit of increased lung sounds. Her lymph nodes were normal. Her GI sounds were normal. Her teeth were normal. She is blind in both eyes, completely 100% non-visual running into things. A lot of the blind horses that we get, it's very obvious when you look at them that they can't see. This mare is not obviously blind. Her eyes look normal until you look closer at her eyes. Based on examination, and I am not an ophthalmologist, based on examination, it appears that she has end-stage anterior uveitis, which is an inflammatory condition where inflammation gets into the eye, and over time it can result in processes that change the pressures in the eye, and you end up with a blind eye. And once the eye is blind, the sight does not ever return. So I just want to be really clear with that. She has some superficial wounds on her hips, her haunches, and over her face. She's wearing shoes on all 4 feet. She's sound at the walk. She does high step. Some blind horses will kind of pick their feet up a little bit higher, and she'd just gotten off a trailer when we were evaluating her. We did blood work on her, and she was very dehydrated when she got here, which actually is sad but really common with blind horses because they can't find the water. So when she first got here, her hematocrit was 69, which is very high, very, very hemoconcentrated. That percentage means how many cells and solid stuff in your blood is there compared to how much liquidy stuff. Major oversimplification. All the clinical pathologists are like, you're terrible at explaining this stuff. She has evidence of infection. So she has elevated neutrophils, which are one of the cells that are first responders when we have infection. So yeah, those are our 2 major concerns with her. And then on her chemistry, she had 1 liver value, GGT, that is elevated. Other liver values looked fine. So what our plan is with her is to try to stabilize her. We are putting her on a refeeding program, We are going to recheck her blood work probably next week. And the plan is to remove both of her eyes. And some people get really upset when you talk about removing eyes. We would never want to remove eyes in a horse that could see if there was any hope of maintaining that vision. This mare is stable. She doesn't currently have entropion, but we did an enucleation on another horse this morning that had entropion. So over time, if the eye gets smaller and smaller, which we know happens in horses that have blindness secondary to anterior uveitis, the eye gets smaller and smaller, and then the lids have more space and they roll inwards. And then when the eyelashes actually touch the cornea itself, the eyeball itself is no longer painful from the pressure, but the cornea has a ton of nerves on it. If you've ever gotten a piece of sand in your eye, it hurts. Your eyes are very innervated on that area. So they can get chronic ulcers in their eyes and literally you can't get away from it because your eyelashes are touching your eye. So if this horse was, Sheldon is a great example. At Sheldon's age, his eye hasn't started shrinking yet. I'm not worried about taking Sheldon's eyes out because he's like 24 years old, but this mare is only 10 years old. And eye removal surgery can be very expensive in private practice. It's probably several $1,000s, and it's something that we can do here at Horse Plus. So we want any horse that we have to get adopted out and to have the healthiest, happiest life they can. This mare already cannot see at all, and we are planning to take both her eyes out once she's a good surgical candidate.
Kyle, B25 181. We named him Kyle. It is also what was on his paperwork that he came with, and we just really liked it for him.
I called him that a couple times, and I feel like he knew that name, so I stuck with it.
He was a 30-year-old gelding, Tennessee walking horse. Sweet, 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 sweet old man. One of the ones that we were hoping at least had little issues so that we could get him to adoption because he was just a sweetheart. Loved his cookies. He got lots of snacks. He was observed coughing while he was outside waiting to be seen. He was covered in snot, but we knew that was from another horse that was out there.
Some of it might have been his.
Maybe a little bit, but
a lot of it was not his.
One guy was sharing his snot with everybody. He did have bilateral cataracts. Most of his other stuff was pretty normal. He did have diarrhea, but lungs sounded good. For coughing, you didn't hear any sounds.
I didn't hear any lung sounds, just really bad coughing and nasal discharge.
His hooves looked good. He did have some reactivity during wither palpation, but otherwise he was sound at a walk. His breathing was a little bit off. And so we did some dental radiographs on him. And he had severe dental pathology. Lots of diastema. His teeth were pretty much gone. They were almost to the gums. He had some furcations. And then, is he the one that had the weird nose thing?
Yes.
So he had a spot in his radiographs. If it's in the footage, you'll hear us talking about it, where it just looked like something was abnormal in his nasal cavity. After reviewing them today, though, with Dr. Marina, it seems like it might have just been a normal finding, but slightly different. So we're not 100% on if that was causing
kind
issues.
Of made like a snorkely sound.
Yeah. So with his dental pathology, we did decide to give him the last act of kindness.
It was so bad.
Mm-hmm.
Like one of his teeth, I think I could have just pulled out with my hand.
Yeah. If you watch videos of us doing radiographs on the horses and you don't even see the radiograph yet and you just see one of us go, ooh, it's probably not going to end great because we usually don't make sounds unless it's really bad.
I don't know if we talked about this. So Dr. Marina is incredible at what she does. Her specialty is zoological medicine, which is how I met her in my previous job. And so she sent our previous BUYOUT radiographs to her colleague who is an equine imaging specialist. And he basically was like, these are the worst images I've ever seen. Where on earth did you come up with this horrific group of patients. I don't want to quote him because I wasn't there. This was third-party information, but they were horrified.
Yeah.
This radiologist was horrified. And this is someone who reviews horse x-rays for a living. So if there was any doubt that we see some, I can't handle the kittens. They're so adorable. Okay. B25-182 is, yay, she's still with us. She's the cutest little 4-year-old mare. She is a thoroughbred who I believe came from the track. She does have a microchip. I have not looked up her microchip number. It's 981-0200-3578-0934. So if any of you out there want to look that up, she is definitely a thoroughbred. She's bright, alert, responsive. She was very sweet and compliant, easy to catch, definitely halter trained. Her heart rate was 30. Her respiratory rate was 12. Respiratory, lymphatic, GI, oral, ophthalmic exams were all within normal limits. She has some significant scars over the side of her left body, her left hind leg, her left kind of hip and haunches. And then she's got hoof overgrowth. She had an old abscess tract on her left front. And then her left front foot, if you look at it, has this weird bump of growth that looks like she had a pretty severe injury to the coronary band, the cells that grow out the hoof. That might always be there, but looks manageable to me. She was sound at the walk. There's no signs that she is pregnant or has ever been pregnant. Her vulva wasn't developed at all. There were no scars there. She has on her left hind leg, kind of below the hock, a big scrape that's like 8 or 10 inches down her leg. Very superficial scrape that's on top of another previous wound with a big bump on that leg. And when we took x-rays of it, she has marked cortical thickening. So cortical bone is the outside of those long bones, and the marrow cavity is inside. So the outside part has a really big, thick bump where the bone was reactive on that left hind cannon bone. She has a little tiny bit of arthritis in her hock, which is probably related to whatever injury, but her hock really looks great. Dr. Marina was like, this is the best radiograph you've ever given me. So we are hopeful that what I suspect is that whatever injury she had was career ending for her as a racehorse, and then somebody just dumped her because she wasn't good for racing anymore, so she was worth nothing to them, which is ridiculous. She's beautiful and young. She's very thin, so she needs to gain some weight, but otherwise, I'm very hopeful for her. Yeah. We have scheduled her for an ultrasound of that left hind leg to try to evaluate soft tissue stuff better.
Is this one that looks exactly the same?
This is the 12-year-old mare. This is the bay mare. Yes.
Yeah, they look almost identical.
Yes, these are the two that are both turned out in
They kind of look like twins.
They do.
So B25-183, she's a 12-year-old mare standardbred. She is also a bay. These two are a little tricky to tell apart because they do look very similar, have very similar markings.
Unless they're trotting, because one of them's gated and one is not.
Yes, but just standing out in the field. She was bright, alert, and responsive, halter broken. She was a little bit hard to catch, but heart rate was normal. Respiratory rate was normal. Pretty much the majority of her findings were normal, which was great. She did have a couple small scars over her neck and shoulders, overgrowth of her hooves. Wasn't painful on palpation of her back. She was sound at a walk. She did have some mammary development. Probably just recently weaned a foal at some point. But overall, she looked really good. So we have high hopes for her. She's just very healthy looking.
A little jumpy, but as soon as you gave her space and kind of calmed down, she calmed way down and let us do everything we needed to.
Yeah, this was a great group of horses. Our buyout was much calmer this time as well. We had a much smaller team. But the horses were also calmer, whether they were reacting to our energy or it was just a really good group.
Yeah. So our last horse, B25-184, was a beautiful 20-year-old stallion. His Coggins that he came in with called him an Arabian. He did have an Arabian looking face. I'm not sure he really was full Arabian. He was very much a stallion. And at the top of his form, on a whole bunch of categories, I have unable to examine due to dangerous behavior. This poor guy was on high alert. He was very nervous. We weren't able to catch him. We were able to run him into our facility. So we have an incredible supporter named Gail. Gail helped us convert a building into our climate-controlled intake barn. And without that facility, we would be so much more limited in what we can do. So our staff was able to get him onto our scale. Normally with moving slowly, I'm able to at least kind of get a hand on a horse, including Mustangs. I mean, we get some really crazy horses. I couldn't get within 1 foot of this horse with my hand without him kicking, and not just kicking, but target kicking. So he was very aware. And thankfully, no one was hurt because our facility has a solid wall. But if we hadn't had a solid wall, he would have nailed me. I'm usually pretty good at gauging where my body is. He would have broken my leg. I'm very thankful for our facility. But he was very aware of his body. He was aware of what his body could do, and he made multiple attempts to kick our staff. Thankfully, nobody was hurt. He was the snot monster. So he was just pouring mucopurulent discharge from his nose, and every other horse, this is kind of gross. Sorry. For you parents out there, you can appreciate this if you have a snotty-nosed toddler. Every other horse that was in the area with him was just covered in snot. And I do want to be clear, it is not advisable. I think in some cases it's even illegal to transport a stallion mixed in with other horses. We attempt to separate stallions out as quickly as possible, but we can't always immediately do it. So this guy got off the trailer with a bunch of other horses, and we got to him as soon as we could, but because of his behavior, we couldn't get to him safely right away. So he was coughing, he had nasal discharge, both of his eyes were red, and he had a lot of ophthalmic discharge. He was absolutely covered in scars. I mean, like,
everywhere.
Not a square inch on his body did not have a scar on it. And he had open, oozing sores all over his face. Some of them looked like they were associated with a halter that had been left on too long, but multiple sores, like actively infected sores. He also had DSLD in both of his hind legs. DSLD stands for deep suspensory limb desmitis. It is a heritable condition. It's chronic, progressive, incurable. So anytime we see it, you should never be breeding that horse. And yet this was a stallion who likely sired babies. DSLD can cause chronic discomfort. And this was a tough one. So we ended up putting this horse in our squeeze chute that was designed for Mustangs. We had to squeeze him to get a blood sample and some nasal discharge. And I wasn't able to even visually examine his wounds or put ointment on them. I couldn't listen to his lungs. Our team met and discussed it, and we felt that two things were true. One, we weren't able to safely provide him with adequate medical care. So his wounds needed to be cleaned, debrided, cultured, treated, not just once, but multiple times until they healed. And that would require the ability to access the animal. So we could have put him under general anesthesia to do that one time, but it's not just an initial, it's an ongoing care. The second thing that we have to keep in mind at Horse Plus is that our board has a strict policy that we don't adopt out any intact animal. So no stallions. That's our board's policy. We didn't make the policy, we just obey it. So we would not have had the option of keeping him as a stallion. We would have had to castrate him. And unfortunately, in some cases, when behaviors go on for a long period of time, those behaviors persist whether you castrate the animal or not. So this guy indicated very strong stallion-like behavior. And we can't blame him for that. It's what he was biologically designed to do. He's supposed to protect his herd. But if that includes herding a human away and turning around and kicking them, that's not acceptable. And we have to be careful as an organization not to allow animals that could injure people seriously to be put up for adoption. So our team discussed, we didn't feel like it was fair to this horse to castrate him as a 20-year-old. And we also felt like we were unable to provide him the care that he needed safely and keep our staff safe. And so he was given the last act of kindness. And if you can see the tension in my face, these are the hard ones. The 30-year-olds and the CPL cases, we got a lot of horses in this group that were very black and white. Doesn't mean they're not heartbreaking, but anytime you throw behavior in the mix, we feel that so much more strongly because we want to do everything we can to save as many horses as we can and to give them their best chance.
And as the vet team, like typically if a horse comes into our general population, we don't make behavioral calls as the vet team. We strictly do medical unless it is that horse is too dangerous for us to provide care. Because safety is our priority. And that's the same thing with the horses that come through buyout is very rarely do we make a behavioral call at buyout. Like that horse has to be extremely dangerous for us to work with and have medical concerns that we need to address. Otherwise, you can turn them out, see if they calm down after 30 days. But if you can't address their medical concerns, then there's not much you can do for them at that point. So
that's tough.
We usually like to leave the behavioral calls to our training and management teams, but sometimes we have to do them.
Thank you for sticking with us. If you donated to save horses out of the slaughter pipeline, thank you so much. I sometimes worry that people are going to be really critical that we fundraised for 20 horses and we only got 13. Please don't stop donating. We promise that anything we get to save a horse from slaughter will be used to save a horse from slaughter. We often have long waiting lists of people contacting us who want to participate in the buyout program. And unfortunately, those horses are often the worst ones we see with fractures and everything else. We're an open door shelter, so we never say no to any horse in any condition at any time. But the buyout program is the only time that there's any money that exchanges hands. And you would be surprised that some people are okay ethically keeping an animal that should be let go until someone's willing to give them anything for it. Thank you for your support of Horse Plus. We appreciate you watching. And this will make a lot more sense if you also watch the videos of the horses themselves. And